A young pastor, Reverend Naku Peter Kondo, has died after reportedly being bitten by a venomous snake while serving as a missionary in Boptin Village, Gamakai District, Langtan South Local Government Area of Plateau State. The death has raised fresh concerns over the growing incidence of fatal snake bites in the community, with reports that at least 2 other Christians have also died from snake bites in the area within the past week. Reverend Kondo was a pastor with the Church of Christ in Nations, Kokin, and had been deployed to Botim as a missionary. His death was announced by a fellow pastor, Rinkia Asaf, who shared the heartbreaking news on the Christian Daily International social media platform on Monday. According to Asaf, Reverend Kondo suffered a snake bite while serving in the mission field and was taken to Sabon Gida Clinic, where he eventually died. The pastor described Kondo's death as a deeply painful loss and expressed concerns about the increasing number of snakebite fatalities being recorded in the community. My heart is deeply saddened by the dismissal of my friend, Pastor Naku Peter Kondo of Kokin Botim, Gamakai in Langtan South Local Government Area, who lost his life to a snake bite at the Sabongida Clinic, Asaf said. He revealed that the death of Reverend Kondo was not an isolated incident. According to him, the same snakebite threat had already claimed the lives of at least 2 other Christians in the community during the preceding week. The development has now raised concerns among residents, farmers, and religious workers operating in the area. Gamakai is regarded as an important agricultural community in Langtan South, with farming serving as a major source of livelihood for its residents. Farmers in the area depend heavily on their farmlands for food production and income, while agricultural produce from Gamakai contribute to food supplies across Langtan South, Plateau State, and other parts of Nigeria. But the reported increase in fatal snake bites is now threatening that agricultural activity. Asaf warned that farmers could become increasingly afraid to enter their farmlands if the situation is not urgently addressed. The pastor described the growing number of snake bites incidents as more than an individual tragedy, saying the situation had become a public health care concern with wider consequences for the community. He said the death should serve as a warning to authorities that urgent action is needed to protect residents. The recent deaths from snake bites in Gamakai have reached an alarming level and demand urgent intervention, Asaf said. He stressed that snake bites should not become a death sentence for people living and working in the community. His appeal comes as questions are being raised about the availability of medical treatments for victims of snake bites and the presence of venomous snakes in the area. Asaf called on health authorities in Plateau State to urgently intervene and investigate the reported increase in the snakebite population. He said authorities need to determine why venomous snakes appear to be increasingly present in the community and what can be done to prevent further attacks. The pastor also called for stronger medical intervention to ensure that people who are bitten receive treatment quickly. According to him, another life should not be lost to a snake bite that could potentially be prevented or treated, he said. He described the situation as an emerging public health emergency requiring immediate attention from authorities at different levels. Asaf called for a coordinated response involving local, state, and federal authorities. He argued that the situation requires more than isolated medical treatment after snake bites occur. According to him, authorities should investigate the environmental conditions contributing to the increase in venomous snakes, while also improving access to emergency treatment for people who suffer bites. His concerns are particularly significant because of the agricultural importance of Gamakai. The community's farmers spend long periods working in fields and rural areas where encounters with snakes can occur. If farmers begin avoiding their farms because of fear of snake bites, the consequences could extend beyond individual households. Reduced farming activity could affect food production and the livelihoods of families who depend on agriculture. ASAP therefore urged authorities to treat the situation as an emergency rather than waiting for more deaths before taking action. Gamakai is an emergency that deserves a swift response from authorities, he said. The death of Reverend Kundu has also caused sadness within the Christian community, particularly among those who knew him and worked alongside him in the mission field. As a missionary with Kokin, he had been serving in the rural community when he reportedly suffered from the fatal snake bites. His death has now placed renewed attention on the risk faced by missionaries, farmers, and other residents working in areas where venomous snakes are common. For the community, the immediate concern is preventing another tragedy. The reported deaths of Reverend Kundu and at least 2 other Christians within 1 week have increased pressure for authorities to respond. Residents need access to medical facilities capable of treating snakebite victims, while health officials may also need to strengthen awareness about snakebite prevention and emergency response. The call for intervention also extends to the environmental conditions around Gamakai. A better understanding of the snake population, its habitat, and the factors contributing to its reported increase could help authorities develop measures to reduce the risk of further attacks. For now, however, the community is mourning the death of a pastor who reportedly lost his life while carrying out his religious duties. Reverend Nako Peter Kondo had been serving as a missionary in Bolton village when the snake bite occurred. He was taken to Sabangida Clinic, but his life could not be saved. His death has left fellow pastors and members of the Christian community grieving while simultaneously drawing attention to a growing danger facing residents of Gamakai. The message from the community is now urgent, and that person must not die from a snake bite that could have been prevented or treated. Authorities at the local, state, and federal levels are being urged to investigate the situation, strengthen medical response, and address the growing threat of venomous snakes in the area. For Gamakai, the issue is no longer simply about one tragic death. It is about the safety of farmers, missionaries, and residents, the protection of agricultural activities, and the urgent need to prevent more families from losing loved ones to snake bites. For more informative reports, stay with us on First Next News. I'm Chidera Isom. Thanks for watching. We'll see you in the next reports.